diagnosis and treatment.
Good evening, we're Team 6, and our presentation is about malaria, focusing on the diagnosis and treatment. I'm Sophia Khan.
I'm Mika Avendaño. I'm Kennedy Artemis.
I'm Sophie Lamb.
I'm Nahir Praveen, and I'm Melody Lee. Just a quick overview of the disease that we have been assigned. Malaria is typically found in tropical and subtropical regions. It is transmitted through mosquito bite and therefore vector-borne. The purpose of the workshops that we are about to present and this presentation as a whole is to help the healthcare workers of Bauchi, Nigeria accurately diagnose and treat malaria patients.
Our goal as a team is to target the healthcare workers of Bauchi, Nigeria, and to further the education or knowledge on the overdiagnosis as well as the treatment dosages of malaria.
So before accurately diagnosing malaria, one must understand that malaria is subcategorized into two categories. Complicated and uncomplicated malaria. Complicated malaria symptoms may be the same as those listed under uncomplicated, but be at a more severe level that will eventually become deadly if not treated properly. Some examples of uncomplicated malaria symptoms include intermittent headache, which can lead to chills and rigors, headaches, vomiting, and nausea.
There are two types of tests doctors can take to see if you have malaria. The first one being taken is the rapid diagnostic test. In the rapid diagnostic test, it only takes 15 minutes and it's not as specific as the microscopy test, which is usually taken after and takes several hours to complete. It is more specific and goes into depth with the species of the malaria parasite.
Accurate diagnosis. Accurate diagnosis is important for treatment of malaria because it is one of the most overdiagnosed treatment diseases. It is important that if a patient was to be inaccurately diagnosed with malaria, they might become resistant to the antibiotics of malaria, which will affect them once they actually do have malaria and then the antibiotics don't work on them. Next, we have disease treatment, and because there's uncomplicated and complicated malaria, there's many types of treatments. Some of them are artemisinin-based combination therapy, which can be concised to ACT, is a mix of medicines used to treat malaria and its symptoms, and is for uncomplicated malaria. There's also IV quinine and IV artesunate, which are for complicated malaria, and they are medicines given through a needle into a vein to treat severe malaria.
Our community workshop is centered around healthcare workers to help them understand the treatment and diagnosis of patients with malaria. We chose to focus on healthcare workers because they will be the ones that are actually going to diagnose and treat patients, and also a lot of them did not go to medical school, so they might not have as much information on malaria as an infectious disease specialist would, and so this is just to help them understand exactly what having malaria constitutes. Overdiagnosis is not only a problem in the United States, but is also a problem in Africa, specifically in Nigeria. Malaria has a lot of overdiagnosis because it contains similar symptoms to other diseases. Overdiagnosis can lead to a lack of having resources to make more medicine, and it can also harm the patients.
So our first exercise in our workshop is a patient simulation diagnosis, where there will be 3 allied staff that will pretend to be mock patients, where we have already written them bios that will have all the information that the doctors may need to properly diagnose them with malaria or not. And those 3 doctors will have their information taken by each of the healthcare workers, who will go around and talk to each of the patients. And after the healthcare workers make their diagnoses, the LI staff will reveal which patient actually had malaria. Here are examples of the patient bios, and as you can see, we gave them fake names, diets, personal history, medical history, and anything that the healthcare workers can need to make an accurate diagnosis. And our goal with this specific exercise is to help combat the overdiagnosis of malaria.
So our second exercise in our workshop is the drug treatment simulation. So basically for this activity, we're going to be having 5 different stations and we'll have 25 different healthcare workers come to this activity. So each station will have at least 1 or 2 leadership initiative staffs assigned, and we'll assign the healthcare workers to these stations. So at these tables, there will be at least 3 of the medicine cups, and they will also be filled with water. The water will be like a substitution for the actual medication. So in this station, they'll basically be able to practice and get a little bit of a training on the correct amount of dosage they should be giving to their patients, which is why I wanted to include this in our workshop. So these are some of the handouts or like the flyers that we'll be handing out during our workshop as well as at the end. So this one right here is the recommended dosages flyer. So it has both of the medications for malaria as well as the recommended dosages for each. And the next one is the one we'll be giving at the end of our workshop. It has the list of the simple symptoms that the patients may experience so they can use it in order to tell if they have the disease of malaria or not in the future.
Our final take-home item for the healthcare workers in Bauchi, Nigeria is a pin that we have designed. It is designed to spread awareness about malaria and the symptoms that it may present. The design features a globe with a mosquito on it representing the global effects of malaria and our hope that malaria cases all over the world can be accurately diagnosed and treated. Our hope is also that healthcare workers can wear these to work or just on everyday life so that they can raise questions about what malaria looks like in patients and how to treat it and how to diagnose it. We want healthcare workers to build trust between them and their patients, and we hope that this pin can inspire confidence in healthcare workers' diagnosis of malaria in their patients. This is a summary of our itemized budget that we will be using for our workshops. This is just a list of materials that we will be expected to have at these workshops, including flyers, pins, and pens. Our total came out to be $206.90, whereas our budget was $500. The remaining money will be used to purchase medication for malaria so that the healthcare workers in Bauchi can use the medication in the future to diagnose and to treat their patients with malaria. Here is our works cited page.